Do you drink a lot of water?
Yes.
Good. Keep that up. That'll really help a ton too. You need to drink like 8 to 12 glasses of water. That's like those bottles of water that you buy, 8 to 12 of those. So what I would do is get a really big container of water. You probably saw the brown container I was carrying around. I drink like 4 of those a day. So knock those out. It's just a necessary evil.
The funds that we can save the system, assuming that there are like 1,750,000 Medicaid births, and if they were managed on this model, it could save $1.9 billion a year, to say nothing of the increase in quality for the families.
My friend came here and she said she liked the services that they provide, like with all the childbirth classes, and she just liked it, so I thought I'd come here. I feel okay now. At first I was a little scared, but now I'm happy.
When did you get your IUD taken out? You know what? Never mind. I think I know. I think somebody wrote a note. If you ask my mom, I've wanted to deliver babies since I was like 8. But after taking a stab at teaching and I have a psych degree, I met a midwife and it just seemed to fit, and just really, really fell in love with what midwifery stands for and just loved it. The difference predominantly between midwifery care and obstetric care is we believe in women empowerment and education. So we try to make sure that the woman is an informed consumer with her care. And we also specialize in natural birth and out of hospital birth. One misconception is that we're not safe, and our stats and our numbers show. We have national data banks that show that our safety is there. There's another misconception that all midwives do is have their babies in the field and sing Kumbaya. That's not true. There's a lot of midwives who don't even deliver. That's not the point. It's to take care of women. But we don't get respected as much here as midwives do in other countries.
I don't know, I feel like I get more support here. Like you're at home. I feel comfortable. It's like another support system. It's like a second mom. Somebody that would be there for you.
So I feel like you're more so not making a bigger baby. You just might be like eating like crazy because you're pregnant and you gotta chill. Because are you exercising? Mm-mm. Okay, great. So Daddy, your job is to make her walk for at least 30 minutes. I'm not talking about walking to Metro. I'm not talking about like walking to a friend's house. You're gonna go walk for 30 minutes.
Midwifery for the sole purpose that I honestly feel like this is something I was called to do. Like, I love being a nurse, but I feel like the ultimate vision for my life is to be able to have autonomy and help women. There are many different things you can do in nursing, but you are under the auspices of, you know, doctors, residents, management, whatever. You're just sort of in a box. So, but I think the way the healthcare reform and torts are going, we'll get, we're already getting 100% reimbursement for Medicare and things of that sort. And these are all changes that have just been happening progressively, and with a lot of us lobbying, like we're crazy lobbyists. I think the biggest asset will be midwives provide access to health care, like primary care, not just like, you know, from the waist down. We're doing like everything, primary care. And I think that alone is going to help health care, just providing greater access. So many health disparities going on right now, and racial disparities. I think midwives just are doing a phenomenal job. And we just got to get more midwives.